Hello and welcome, guys. I'm Dr. Vipin Tomar, consultant osteopath and physiotherapist practicing in Gurgaon. Because today I'm going to present my topic on understanding the core links of the body through tensegrity structure. But before we start our topic, I will really congratulate and appreciate the whole HCAP team and especially the Dr. R.K. Mudgil for this innovative learning platform. It's a huge platform where the participants nationally and internationally are linked, learning new concepts, and special thanks for giving me a chance as a resource person to express my ideas and to express my experience with each and every one. So guys, let's start today. My topic is on core links of the body through tensegrity structures. But before we start our topic, it's very important to understand the whole body works as a single unit, where each and every parts of the body, each and every system, each and every structures are well interconnected through fibrous connective tissue, which is called fascia. And in layman terms, we can say the fascia, it is a covering. It's a covering of the body, which connects system to system, parts, structure to structures, and cell to cells throughout the body, and to maintain a harmony between each and every systems. So there is a link anatomically and physiologically. The whole body is interconnected. It works as a single unit. Each and every part, each and every system, each and every function is well connected. If functionally, if we talk about, like, each and every parts in the body have their own specific function to achieve. Like, for an example, like central nervous system, which is controlling the musculoskeletal system. There is another autonomic nervous system which is controlling the visceral activity. Another example, like there is endocrine system which is controlling the hormonal balance in the body, and the immune system which plays a very defensive role against any problem in the body. So there is a link, and it is very important to open up your vision for global diagnosis, because as I was listening Dr. Naveen Ganar, he was also pressurizing the global diagnosis. This is how global diagnosis is very important, because in some case it is good when you go locally and you treat the patient very well and you are getting very good results, but somehow there are some patients which are not responding to the treatment locally, because at that point of time you need a differential diagnosis. You need to look the whole body as a single unit. You need to diagnose globally. You look elsewhere in the body. Suppose a patient comes to you for the shoulder pain and you are treating. First you assist the patient, physically examining the patient, and you treat the patient, and you are getting very good results. Patient comes to you and says he is getting better, but out of them there are some patients who are not saying that I am getting better. In that case you are not pressing the right button. You are not treating the key lesion. You are just treating the symptoms and you are giving some temporary relief to the patient. In that case you need to look further. You need to read the whole body. You need a global diagnosis, you need a differential diagnosis, and in that case you need to relate each and every part of the body, how it is connected. Similarly, now moving to the next, structural system, which is composed of compression element connected by a continuous tension element, in which the tension and the compression force are equally distributed within the structures in such a way that the whole parts have to bear minimum strain to stabilize or to maintain the harmony of the tensegrity structures. This is the definition of tensegrity and how we can relate this tensegrity structures to the human body. It's very simple. I'll show you one picture and we'll try to relate according to that picture. It relates with the musculoskeletal system. We can relate this picture with the musculoskeletal system. Let me show you that picture. See, to understand that tensegrity structures, there is a very simple example, stick and spring model, in which these structures you can relate with the musculoskeletal system, in which this stick represents the bone and the continuous tension element which represents the soft tissue throughout the body is a single. This tensile elements, or you can say the soft tissue, which is a single, it's a covering continuous structures, and this is a discontinuous structures which represents the bone. Now we relate this structure with the musculoskeletal system. If there is a problem, if you put any pressure on any parts of any structures or any parts of the structures, and the force you put on these structures, it will be distributed equally to the each structure. Similarly, when there is a dysfunction in the body, when the bone is subluxated and misaligned bone will put pressure on each and every structures of the tensegrity system, or you can say the body. Similarly, when there is a problem in the soft tissue, whether it is a fascia, whether there is a ligament injury, and whether there is a muscle imbalances, that will also going to put pressure on each and every parts of the body to maintain the center of gravity and to maintain the upright posture. But this time, when there is any imbalance in the body and the body try to compensate to maintain the whole structure, this time the force on each and every part will be higher, and each and every part will have to work harder to maintain the body equilibrium or to maintain the body in a harmonic state. This is how you can relate one structure to the other, one part to the other, one system to the other. Similarly, there is a, and now moving to the core links of the body, there are two main kind of core links. One is neural core links and the second one is visceral core links. Why I am because at the end of this presentation I'll share one case history with you all guys, in which I am adding all I'm working on 2-3 systems together for one single problem. That's why I'm telling you the core links, I'm telling you the visceral core links, I'm telling you the tensegrity structures. If you talk about the neural core links, there is a connection between the brain, the spine and the peripheral nerves through the dura maters, which connects various cranial bones to the vertebra and runs throughout the length of the spine up to the sacrum. Through this connection, the whole central nervous system works as a single organ. Any problem in the upper parts can lead to the pain in the pelvic area, and if there is any problem, like if sacrum the misaligned or any dysfunction in the sacrum is stuck posteriorly, stuck anteriorly, that can lead to the problem up to the brain because of this dural connection. If sacrum is stuck in the posteriorly, there will be some increased tension in the dura mater, and that can lead any dysfunction that can activate the pain reflexes in the dura, and that can cause pain elsewhere in the body. Similarly, if we talk about the visceral core links, which starts from the base of the cranium to the neck, through the mediastinum, through the diaphragm, abdominal cavity, up to the pelvic. So these are the main core links, and how we can relate all structures, one structures to the other. I'll show you one tensegrity structural system in which we will try to relate this system with the human body. First of all, let me tell you what is tensegrity and when it was founded. There is one architect, Richard Buckminster Fuller, and one of his student, Kenneth Nelson, in 1948, they built first tensegrity structures, and this concept being more applicable on the human body. Similarly, another example of a balloon which you can relate with the body cavities, especially the thoracic and abdominopelvic cavities, which plays a very important role to keep the structures, to keep the upright structures. And like a balloon, there is a continuous stretching rubber skin which is being pushed by the air molecule within to keep the balloon inflate. Similarly, the cavity, the body cavity, which is filled by the visceral organs and the fluid, which put pressure on the facial component of the body to keep the cavity inflamed. Similarly, when we push the balloon, when you push the balloon at any point, the pressure, the external pressure you are giving to the balloon, you are putting on the balloon, that will be equally distributed to the skin structures and the internal molecules. Similarly, with the body, when there is a problem with one organ, because organs are very well attached with the fascia, surrounding fascia and the surrounding, to the next cavity, to the next structures, to the next organs. When there is some problem in one component on one viscera or one organ, that will lead some problem to the other organs. This is called the visceral dysfunctions. Similarly, the visceras are very well connected to the musculoskeletal system through the facial link. Any problem in the viscera can lead to the problem to the any musculoskeletal. So guys, through these two stick and string and the balloon model, I tried to make you understand the importance of global diagnosis and how the core links between the body is important, how the central nervous system, the whole central nervous system works as a single organ. Similarly, how the cavities and the visceral cavities in the body works as a single element. Problem in one cavity will lead to the problem in the another cavities. So according to that, you need to understand and the importance of the global diagnosis. Again, the differential diagnosis, the whole body screening is important. When the patient is coming to you for any problem, you need to go, if you have a time, if you don't have time, but if you have, you should go for a global diagnosis. It won't take too much time. And as I was listening, Dr. Naveen, he was also emphasizing on global diagnosis. He was giving some example like when there is a problem, the minor problem in the ankle joint can lead to the problem in the pelvic joint. This is how your tensegrity structure system is connected. This is how the body, the parts, each and everything is connected to each other. Any biomechanics, if you change any biomechanics to any joints, it will lead the problem to the surrounding structures, not only the joints but also the supporting structure as well. So guys, when the conclusion is that whenever there is a movement disorder or any alteration in one elastic or compressive component, the body has a tendency to compensate, and the body will preset itself to adapt the new position. But this time, to maintain the equilibrium, because of that unnecessary unwanted dysfunction, to maintain the body in a harmonic state, the all parts, the all organs of the body, each and every structures of the body will have to work hard, will have to consume more energy, will have to put more strain. So what is your work at that point of time? You just need to take out that external force of the body. You just need to trigger that button which is pressing or creating more pressure throughout the body, and the body will gradually will returns, because body has a self-regulating and self-maintaining process. The body will return to its normal state. Now guys, it's time to present or one case history including all system, how they all are well connected. And there is one of my patient comes to me for the back pain, and I diagnosed her, and I start treating her. So and she came to me on every alternate day, and एक दिन she came to me, और वो अपने एक 10 years old बेटे को साथ में लेके मेरे पास आई. I don't know why, but somehow we started discussion, and she told me that कि उसका जो बेटा है, he has some problem. He is a 10-year-old kid now, and for last 4 to 7 years they have visited many doctors, many pediatricians, many gastroenterologists, and somehow they did their well, they tried everything, and we were discussing something, what is the problem. Then she told me one thing, like whenever जब भी ये कुछ खाता है, इसको बहुत ज़्यादा वर्ब्स आना स्टार्ट हो जाती है, एंड इतनी ज़्यादा आ जाती है, इतनी ज़्यादा फ्रीक्वेंसी इंटेंसिटी के साथ होती है कि अगर ना उसको ये वर्ब्स नहीं आती तो ही फेल्ट अनकॉन्शियस, और उसको कुछ ऐसी प्रॉब्लम हो जाती है अगर वो नहीं आए तो, और वो कॉन्टिन्यूसली आती रहती है. तो एट दैट टाइम, and they discussed each and everything with the pediatrician, some other doctors as well, physician, everybody. But everybody says there is some allergic problem, milk product, allergy from the milk product, some other problems. Then I, frankly speaking, मैंने patient को बोला कि आप, I don't know whether I can do it or not, but let me treat and see. Then what I did with the patient, how I combine all structures, that 2-3 systems all together through these core links. I diagnosed that baby. There was some problem in the diaphragm, the visceral, the liver, and some other problems. Then I start the treatment. First I mobilize the sacrum, because as I told you, the whole central nervous system is a single unit. First I mobilize the sacrum to increase the mobility of the dural membrane. Second, I release the respiratory diaphragm, okay, to improve the liver function. And third, I give some the subclavicular thoracic area, I give some lymphatic pumpings, because in this there is another diaphragm which is called the thoracic inlet diaphragm, where the lymphatics merge with the veins. So I give some lymphatic pumpings to improve the lymphatic system. Then after that, in the end, I release the suboccipital muscles, and in the end I mobilize the esophagus. And guys, frankly speaking, twice when I treated once, the patient came to me after 2 days and they said कि बच्चा 70% ठीक है. He is taking milk products, there is no problem. And one again after 2-3 days, again I repeat the same cycle, and he is now 95% he is okay. Verbs is there, but it is a digestion process. Sometimes 1 or 2, and the people are very happy. And that's why I was talking about the links with the practice. And the same patient referred to me many patients, and अकेले पेशेंट ने मेरे पास बहुत से पेशेंट्स को रेफर किया. who was having some digestive problem, who was having some acidic problem, who was having some constipation problem. So this is why how you can increase your practice base by adding this diagnostic system, this whole body screening in your diagnosis, global diagnosis. And one more link I would like to tell you, if you are working with a sports person, anyone who is very much active in the sports activity, maybe cricket, maybe basketball, maybe some tennis, I'll show you one picture. Because in that case, if somebody comes to you with the shoulder pain, because there are so many people in clinical practice, working in the clinic, working in the hospitals, they have seen so many patients comes to you and complaining of shoulder pain. They said कि किसी एक moment में pain होता है. When you see the range of motion is okay, active range of motion is okay, passive range of motion is okay, and all structures, all movements are fine, all you go for physical test, that is okay. But patient is still complaining that when I do some movements, it hurts. At that time, you need to look not only the shoulder, you need to look somewhere else in the body, because the problem is not in the shoulder, problem is elsewhere in the body. So understanding this, I'll show you one pic how it can be linked, how this shoulder pain can be linked to the other structures if we are working with any sports person, like this. See, this is a very simple structure. You see the glutes, the latissimus, which is connecting to the inferior angle of the spine and to the humerus. This is a link. When the patient comes to you that he has a pain in some specific movements, not all the time. Otherwise, when he do some specific movement, the pain occurs. In that case, you need to look somewhere else, like this. In playing a cricket or playing some, when bowling or playing some basketball, when there is a loading phase, when anybody who puts pressure on one leg, if there is a glutes max, that there is glute muscles which are misfiring, which are not strong enough, which plays a prime stabilizer role in the sacroiliac joint. If this muscle is weak, is not firing properly, at that point of time your latissimus dorsi muscle will contract, become hyperactive to stabilize the sacroiliac joint. And in this condition, when it is hyperactive and very tight, the patient performs some abduction and external rotation activity, it will hurt the patient. So when you will treating this kind of patients, always look for the sacroiliac and the glutes. It could be weak. It is on the either side. Suppose always if the patient have right shoulder pain, you will look on the left glutes. If the patient have left shoulder pain, you will work on the right glutes. So guys, in the end, through this tensegrity structure, through this string and model, and through this balloon model, I try to make you understand the links between the whole body, and finally I hope you all guys will come to know the importance of global diagnosis and the differential diagnosis. The screening of the whole body is very important. Whenever you are treating any patients, just go for it. Just do a global diagnosis, the whole body screening, and definitely you will be getting good result. You will improve your practice. And finally, if you guys have any queries, you can message me on Facebook. I will try my level best to solve your queries. And finally, I would really thanks to HCAP for giving me a chance to express my ideas. And thank you so much guys for giving me your valuable time. Thank you so much for listening me. Thanks to all.